want to thank Dr. Lee for giving us such a thoughtful talk. We've been trying to get him here for a few years now, so I'm so glad to have him here. Obviously talking about some very serious issues, and we look forward to the discussion. I also want to thank Dr. Hoda Mahmoudi for once again partnering with the Department of Sociology's Critical Race Initiative. My name is Richardson. I'm an assistant professor here in the Department of Sociology, and I have the honor of introducing our next guest, who will be presenting Dr. Joseph Richardson, who is an associate professor here in the Department of African American Studies. Dr. Richardson received his PhD from Rutgers University in the School of Criminal Justice and his bachelor's degree in African and African American Studies from University of Virginia. He completed a Spencer Foundation postdoctoral fellowship at the University of Chicago, as well as an NIMH-funded clinical postdoctoral research training postdoc at Morehouse School of Medicine, as well as the University of North Carolina School of Medicine. Dr. Richardson's research focuses primarily on four main areas: gun violence and trauma, incarceration as a social determinant of health, the Black male life course and health risk behaviors, and parenting strategies for low-income Black male youth. Trained as an urban ethnographer and medical anthropologist, Dr. Richardson is the director of the Violence Intervention Research Project at Prince George's County Hospital Trauma Center, which is actually the busiest level 2 trauma center in the United States. He is also the principal investigator of 2 longitudinal qualitative studies, one which is looking at the linkages between repeat violence injury as well as HIV risk behaviors, in addition to doing some research on after individuals who have been injured, how they deal with the Affordable Care Act and trying to secure health insurance. He's also done some research as the co-director of the Capital Region Violence Intervention Program, which is an emerging hospital violence intervention program at Prince George's County Hospital, as well as being the co-investigator of the National Drug Early Warning System, and being the director of the Rapid Response Team, which received a $3 million grant. I could go on and on about all of the great things. Huh? Right. That's funny. A lot of money, Joe. A lot of money. So it was $3 million, right? Yeah. Yeah, okay. And so... but I mean, some other things that he's done. He's put together some short documentaries. No, I want to say a couple more things. Short documentaries, and the reason why I do, because I think the sort of work that Dr. Richardson is doing is extremely important in and outside of the university. And I think oftentimes people don't get credit for that type of work, right? So I want to make sure that we really stress the way that his work kind of runs together. Particularly in terms of doing this short documentary, Bullets Without Names, as well as being the producer of another film every 80 minutes. So with that being said, I'll stop there.
Good afternoon. I want to thank Dr. Ray. Your check is in the mail. He's my PR guy. And Dr. Mahmoudi, and particularly my new brother from another mother, Dr. Ju Young Lee, who we checked off the list: gun violence, hip hop, and jujitsu. So, and last but not least, I'd like to thank my fiance, who's sitting over there, who had to listen to me talk for weeks about all things Freddie Gray. So thank you for enduring that. So let me talk a little bit about how I even arrived at this topic. I was really interested in the concept of structural violence, and I had read about it in some of the work by Paul Farmer and others. And when Freddie Gray was first killed, the Baltimore Sun had ran a couple of articles about Freddie Gray's neighborhood, in which I will talk about more extensively in my talk, and what the neighborhood context really looked like for someone growing up in his neighborhood, Sandtown, Winchester, in Harlem Park in West Baltimore. And it made me really reflect on, well, how do people who live in these neighborhoods, how are they not only victims of direct violence, and we've heard extensively about that through Dr. Lee's talk, but how are they also victims of violence that we really cannot see? And the purpose of my talk, and hopefully at the end of this talk, I'll be persuasive enough that I'll convince you that structural violence is as equal, if not even more harmful in some cases, than those who experience direct violence and trauma. And so I'm just going to walk through the timeline. For those of you who don't know about the Freddie Gray case, I think it was important to give some context to it, and then I'll go into my talk in a little bit more substance. So Freddie Gray was stopped at 8:39 at the intersection of North Avenue and Mount Street. And what I want to say, what's really interesting, is the reason why he ran is because he had made eye contact. The officer had made eye contact with two individuals, and one of them was Freddie Gray, and a pursuit happened. By 8:40, Gray was apprehended and arrested in the 1700 block of Pressbury Street. The police stated that Gray stopped voluntarily and they did not use any force, but an officer had taken out his taser but did not use it. By 8:42, a police van was requested to transport Gray to the police station, at which time Gray requested an inhaler. And this is one of the pictures of Gray being arrested. This is another one. I just want you to take a good look at his face. By 8:46, the driver of the van believes Gray is acting irate. In the back of the van, police stop the van so paperwork can be completed. Interesting. At that point, Gray is placed in leg irons and put in the back of the wagon. Multiple witnesses say that Gray was beaten. They saw Gray beaten, but police evidence, including an autopsy, disputed their accounts. And this is him being taken to the van. Between 8:54 and 8:59, the wagon transporting Gray made an unknown stop. Surveillance footage claims that it was indicated stopped at Fremont and Marshall Streets. And by 8:59, that driver of the van had requested additional units to drive over and check on Gray in the back. And minutes later, the van is requested to pick up another prisoner. And if you know the story of Freddie Gray, they tried to implicate that person in the back of the van as saying Freddie Gray was intentionally bouncing himself around in the back of that van. That was later refuted by that person who was arrested with him. The van drives to the Western Police District Station with both suspects. By 9:26, the city fire department gets a call for an unconscious male at the Western District Police Station, and Gray is in serious medical distress. 7 minutes later, the EMS paramedics arrive and provide patient care for 21 minutes before departing to shock trauma, where I currently conduct my work on violent injury among young black men. And by 10 o'clock, the EMS arrives, and where Gray would remain until his death a week later. And on April 14th, he undergoes a double surgery on his spine. By April 15th to the 18th, he remains in a coma. And as we all know, by April 18th, the protests begin in Baltimore. A nice night for a revolution. By April 19th, at approximately 7 a.m., Freddie Gray dies as shock trauma after suffering from a broken vertebrae. Gray's family releases a statement stating 80% of Gray's spine was severed. And by April 21st, 6 officers were suspended with pay in connection with the investigation. That is a picture of Freddie Gray. April 24th, former Baltimore police officer Chief Batts acknowledges mistakes in Gray's death. We know he was not buckled in the transportation wagon as he should have been. No excuses from me. Protests erupt, and on April 30th, State Attorney Marilyn Mosby rules Freddie Gray's death as a homicide, and by May 1st, 6 officers are charged in Freddie Gray's death. September 8th, Freddie Gray receives a $6.4 million settlement. and the 6 officers await his charges. Now, at that point, in most cases, we could have all walked away thinking that justice was served. He got $6.4 million. It's one of the largest, if not the largest, payout by the Baltimore City in a police brutality case. And most of us would have said, well, that's justice. $6.4 million is a lot of money. But really, what does that mean in the context of structural violence in his neighborhood? And this is his community, Sandtown. I thought this was an interesting picture because if you know anything about homicide, and homicides in most inner city neighborhoods, that's a shrine. And you can find them in Philadelphia, the south side of Chicago, south central Los Angeles, the west side of Baltimore, southeast DC. They're ubiquitous. I thought this was an interesting picture because this is that child's playground. And so what is structural violence? Well, I'm going to answer that for you. Structural violence is a concept which emerged from the research on violence, peace research, and human rights. And according to Galtung, who was the pioneering theory of structural violence, it's the definition of violence. He defined it as violence being too narrow and limited to the injuring or killing at the hands of an actor who intends this as a consequence. He defines it as the cause of the difference between the potential and the actual, between what could have been and what is. And so let me give you an example. If a person died from tuberculosis in the 18th century, it would be hard to conceive of this as violence, since it might have been quite avoidable. But if he or she dies from it today, despite all the medical resources in the world, then violence is present in our definition. I want us to think about that as the framework as I move through this presentation. And so Paul Farmer, who is a doctor at Harvard Medical School. He is also one of the co-founders of Partners in Health, which provides a lot of international aid work, particularly in Haiti. And he's one of the pioneering theorists of structural violence. And I've borrowed much of what I know about structural violence from the way that he's framed it. And so structural violence, at the heart of it, is structural inequality. And structural violence is exerted systematically, indirectly by everyone who belongs to a certain social order. Is it intended to inform the study of the social machinery of oppression? It enables the conditions of structures that are both sinful and ostensibly nobody's fault. And so when we think about our work, and Dr. Lee and I do a lot of work in inner city communities with young black men who have been violently injured, I think it's very important to talk about Freddie Gray's death and also the men that we follow as ethnographically visible. And we often think about the people that we see in our work and how we write about their lives in the context of their lives, but we really never talk about the invisible genocide, what we cannot see. Those factors that contribute to the death of young black men in poor inner city communities and the conditions that create the context for homicide that we really do not pay that much attention to, but are violent. And so I think anthropology that tallies the body count must of course look at the dead, but it must also include an analysis of those left for dead. And so Galtung frames structural violence as violence that kills, although slowly and undramatically, from the point of view of direct violence, where direct violence is framed as violence that kills quickly. Structural violence is violence that is anonymous, while direct violence is violence that has an author. And And so when we think about direct violence, we often think about it in the number of deaths. We can think about it in terms of homicides. We think about it in the number of people that die from HIV every year, the number of people that may die from TB or other chronic diseases that we know could be prevented. And the structural violence is approached by looking at the number of deaths that could be avoided or avertable, because social, medical, and sanitary resources are not concentrated in the lower classes and the working class neighborhoods of Sandtown, where it could be averted but not, but those resources are typically classified and resource heavy in communities that are upper middle class and upper middle class. And so another way of looking at structural violence is if a society has the resources, medical, organizational, and financial, to give an average life expectancy of X years to its members, then the question is whether the average life expectancy of social groups is correlated with social position, so that the lower social position equates to the lower life expectancy. And so Paul Farmer does a lot of work, as I mentioned, in Haiti on HIV and AIDS. He looks at the way that people are often ethnographically visible, but the invisible conditions that exist in that community, and how inequality creates and contributes to life expectancy or the lowering of life expectancy over time. And so one of the things that he talks about is the erasure of history. And this is very important as I move on to think about it in the context of Sandtown, Winchester, because often when we look at the conditions of Haiti in the present, we tend to forget about how Haiti arrived at that place. And so Haiti was colonized by the French and was contingent on slave labor. And as you can see, by the 1780s, the slave population in Haiti stood at 460,000 people, which was the largest number of slaves held in any Caribbean colony. By 1803, there was a Haitian Revolution, and Haiti became the first independent republic. But what ended up happening is that the Western and imperialistic concerns arose over the self-governance of blacks. And then structural violence began as the French and Western powers, i.e. the United States, engaged in embargoes against Haiti, where Haiti no longer could sell products like sugar and coffee to the Europeans or the US. What happened in the reparations, and you would typically think, right, our logical, intuitive sense would think, well, Haiti would deserve those reparations, right? Well, no. The new Haitian government owed 150 million francs as reparations to their slave owners, starting Haiti out in debt. And so as GNP declined, so did life expectancy. And banks such as the Inter-American Development Bank withheld loans earmarked for development and improving health, education, and water quality in Haiti. Corruption and the mismanagement of funds and aid was given to NGOs instead of the Ministry of Health. And as we see now, Haiti quickly became and remains the poorest country in the Western Hemisphere. And the reason why those loans were held back is because they could not pay back their reparations. So until they paid that back in full, then the Inter-American Developmental Bank and banks such as the IMF held on to those loans, basically strangling the economy, the Haitian economy. And so does Baltimore suffer from similar conditions as a result of an embargo of resources in urban colonies or poor neighborhoods such as Sandtown, Winchester, and Harlem Park? And so this is neighborhood poverty in Baltimore. And if you look anything west of that, this small dot, which I'll have to work with. This is the west side and east side of Baltimore. You can see the darker spaces where the population lives below the poverty line. And that encompasses Freddie Gray's neighborhood. I'll get back to this one. So, These are the numbers. So SW/HP is Sandtown, Winchester, Harlem Park, and BC is not before Christ, but it is Baltimore City. And as you can see, the numbers, almost 90% of the population is black, 24,000 medium income. The unemployment rate is almost double the rate in Baltimore City. The unemployment rate from ages 16 to 64 is almost 52%. 32% of the families live in poverty, double the rate in Baltimore. 37% single-parent households, and almost 50% of the children live in poverty. Again, almost 50% of 9th to 12th grade students are chronically absent. That means they've missed more than 20 days of school per year. The population with 25 years or older with less than a high school diploma is 75%. And third graders at proficient reading level is 66%. Why that's so important is because we often predict third grade reading levels are often predictive of how many people will drop out of school. And we know that a significant majority of those who are in the criminal justice system have dropped out of school, and particularly in Baltimore City. And so I'm going to run through some structural conditions to just show you comparatively what it looks like in Sandtown, Winchester, compared to Baltimore City. And this is the neighborhood environment, and the alcohol store density, tobacco store density, and corner store density, and this is per 10,000 residents in this community. And so again, you can see in comparison to Baltimore City, in just about every category, the numbers have doubled. Corner store density, I think, is really important. And one of the reasons why is in the recent conversation by President Obama, he talked in explicit detail about food deserts. And one of the things that he said is that in many neighborhoods throughout the United States, particularly poor communities of color, it's often easier to purchase a firearm than it is to get a healthy meal. And so when you think about the density of alcohol, tobacco, two of the things that are significant killers and top 10 consequences in early mortality among African Americans, it's clearly that Sandtown, Winchester suffered from that, or suffers from that. Neighborhood environment regarding lead paint, and I will make this, and I pay attention to this very closely because I get into the life of Freddie Gray. The lead paint issue will come up again. So we can see that in lead paint violations, and this is per 10,000 households in the neighborhood, it's 3 times the level than it is in Baltimore City. Almost twice with children with elevated blood lead levels. And then the energy cutoff rate, which is when your water and electricity is cut off, is double. Vacant building density, percentage of abandoned properties, and vacant lot density. Same story. I don't think this will change throughout any of this discussion, but it's helpful and useful for me to provide these numbers. As you can see in the majority of categories, and particularly if you look at the percentage of abandoned properties, 1 out of every 3 properties in Sandtown, Winchester is abandoned. And this is what it looks like. And so in the darkest colors have the highest percentages of abandoned properties in 2013, and you can see Sandtown, Winchester falls into that group. And these are just some of the numbers. Hospitalization for discharge for diabetes type 1 and type 2. And this is for Baltimore City, not Sandtown, Winchester. And again, you can see in just about every category, it's either double or triple the number between whites and blacks. particularly in hypertension, which would be related to living in a toxic neighborhood environment as well as diet. New HIV diagnosis. You talk about the work of Paul Farmer in Haiti and HIV. 86% of all new HIV diagnoses in Baltimore are Black. Primary and secondary syphilis, which are often correlated to HIV infection, are 55.8. And then this is the youth rate per 10,000 residents. And you can see, particularly gonorrhea and chlamydia, the numbers are off the charts. I'll let you look at the rate of chlamydia for a minute. And if you are not diagnosed, it actually, if anyone knows much about sexually transmitted infections, if you are not diagnosed, it actually raises the likelihood that if you encounter someone who has HIV, the likelihood of you getting HIV with an undiagnosed gonorrhea or chlamydia or syphilis infection raises the likelihood of being infected. So I'm going to shift off for a minute, and this is what the murders in Baltimore look like as of today. To the left, we have all the homicides on the west side of Baltimore, and to the right, we have all the Baltimore homicides on the east side and then the northwest side. And if I were to scroll and just give you an idea of what it looks like, we'll start at number 1, which happened on January 3rd of this year. And if we keep scrolling down, 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 we arrive at 286 homicides. It's the largest number of homicides since 1999 in Baltimore City. And many are shootings. So to continue with the narrative on violence, domestic violence, non-fatal shooting, and homicide violence, these are what the numbers look like. Again, in Sandtown, Winchester, almost double in every single category. And so I know Dr. Lee talked a great deal about his work in the trauma unit, and I'm going to talk a little bit about my own. The average cost of a murder is $17.2 million. So you think about those 286 homicides, it's a lot of money. That includes the cost of the investigation, the cost of taking someone to court, and the cost of incarcerating someone for a homicide if that homicide's solved. Now, in cities like Baltimore, the homicide closure rate is only between 30 and 40%. And that may be the result of an overtaxed homicide squad, as well as residents who are unwilling to engage in cooperating with the police because a climate has been created of distrust. The average cost for a violent firearm injury in stay is $23,000. $1 million blocks. What does that mean? The cost of incarceration. Well, data and geographic context show people in prison are highly concentrated in specific neighborhoods. And so this is what juvenile arrests look like in Sandtown, Winchester. 25% of all 10 to 17-year-olds in Freddie Gray's neighborhood were arrested at some point between 2005 and 2009. And this is what it looks like per 10,000 residents. Again, you can see the disparities in the numbers. But how is Sandtown Winchester $1 million block? Sandtown Winchester sent 458 people to state prisons in Maryland. They sent the most people from one census tract to state prisons in Maryland than any other community in the state. It's a virtual pipeline to the state prison system. 3% of all the community residents in Sandtown Winchester are incarcerated. And if you think about the cost of incarcerating people from that one neighborhood, that one census tract, $17 million. And if you divide that by the 72 square blocks in Sandtown Winchester, that's $236,000 per block. The state of Maryland spends $288 million to incarcerate people from Baltimore alone. And 6% of that budget represents people from Sandtown Winchester. $47 million is spent incarcerating people from the west side of Baltimore, which is and Sandtown Winchester represents 36% of the incarceration budget from one side of the city. Over a third. And 1 out of every 3 of the state's prison population in Maryland is from Baltimore. But what could we have done if we spent that same $16 million per person? This is all the things that we could have done. We could have provided drug treatment for 3,771 adults, 14,000 people that live in Sandtown Winchester. Employment training for 5,000 per person. We could have supplied that to almost 4,000 people. Housing per month at almost $1,300 a month. We could have provided that for 13,000 families. And for a GED course, considering that majority of people, young men there, don't make it out of high school, $1,000 per person for almost 17,000 students. Life expectancy. How long can one expect to live in Sandtown Winchester? 65.3 years compared to 71.8 in Baltimore City, and even that's low because the average life expectancy in the US is 78 years. But the reason why I asterisk that 65.3, is because the average life expectancy in Haiti is 65.1 years. And this is the age-adjusted mortality for all causes of death, and these are the total annual loss years, annual years of potential lost life. Avertible deaths, and this is at the heart of structural violence. Deaths that could have been avoided if all Baltimore communities had the same opportunities at health, with the assumption that the death rates achieved in 5 communities with the highest income should be achievable in every community. 51% of all the deaths in Sandtown Winchester could have been averted. And this is the infant mortality rate, again, almost double. These are the top 10 causes of death. And you can see just about for every indice, they double the rate for Baltimore City. And this is the mortality by age. I asterisk 25 to 44 years old because Freddie Gray was killed when he was 25 years old. And so there was a study conducted on the well-being of adolescents in vulnerable communities. And they did a study on communities in Baltimore, communities in Shanghai, New Delhi, a city in Nigeria, and also Johannesburg. This is a picture of, on your left, would be a picture of a neighborhood in Baltimore, and on your right is a neighborhood in Nigeria. And so these are the perceptions of the community. So physical environment The lower the number gets, that means that the male respondents had a poorer perception of their community and also social cohesion, a poorer perception of social cohesion, and then the witnesses to community violence. You could see that goes by how many events that they may have witnessed. And so you could see Baltimore and Johannesburg were somewhat similar as far as social cohesion and physical environment and witnessing more community violence. And that was for male respondents. This is for female. And so this study was conducted by Johns Hopkins School of Public Health, where they interviewed 2,400 15 and 19-year-olds in the following cities. And they found that adolescents in Baltimore and Johannesburg experienced the highest prevalence rates of health problems, including high levels of victimization, sexual violence, substance abuse, depression, and PTSD. And more importantly, adolescents in those cities held the poorest perceptions about their communities. Despite having the 19th highest GDP in the country, youth in the most troubled neighborhoods of Baltimore reported some of the worst conditions among youth in the 5 cities. And though youth in Baltimore experience similar levels of physical decay as those in other poor communities around the world, they feel worse about their environments. And then regarding, I said earlier about the lack of police trust and distrust, over 80% of Baltimore youth in the study had little or no trust in the police, the justice system, the broader government, or other public authorities. And so another study was done by 2 researchers at Harvard on the impact of neighborhoods and intergenerational mobility, which found that male children who are raised in below medium income families in Baltimore earn 1.4 less in adult family income for each year that they're exposed to that neighborhood. So a man who spent his entire child in young adulthood, 20 years in Baltimore, would earn about 28% less relative than the national average as an adult. And Baltimore ranked the worst among 100 largest counties in the U.S. And so Paul Farmer discusses in great detail how history is often erased, and the history of Haiti was erased. Well, I'm going to talk a little bit about how history was erased in the disinvestment and the mismanagement of funds and corruption in the investment in Baltimore. And so in the last 1989, $130 million in public and private investment was supposed to be invested in what was once a thriving neighborhood of Sandtown, Winchester. In fact, this is what it looks like today. It was known in Baltimore as Baltimore's version of Harlem. It was home to Thurgood Marshall, Billie Holiday, and Cab Calloway. And in 1989, as I mentioned, the city and local leaders planned to rehabilitate hundreds of houses. But midway through the revitalization efforts, the federal authorities found that millions of taxpayer dollars meant to fix up homes were spent on repairs that were either faulty or never completed. And then local prosecutors also investigated a program intended to invest in providing poor pregnant women with care and to get prenatal care, but they found that $3.2 million of the federally funded money was mismanaged. And so what does that mean in the structural violence and slow death of Freddie Gray and the lead poisoning in his neighborhood and the lack of prenatal care? All of his siblings were born premature. Freddie Gray and his 2 sisters were found to having damaging lead levels in their blood, which led to multiple educational, behavioral, and medical problems. Gray and his siblings had lead levels above 10 micrograms per deciliter that the state law defines as the threshold for lead poisoning, and the Center for Disease Control, the CDC, considers lead poisoning above 5 micrograms a cause for concern. But court documents show
that in a 7-year period between the ages of 2 and 9 for Freddie Gray, he was tested 6 times. His range was between 11 and 19 micrograms per deciliter. And in 2008, they filed a lawsuit against the owner of the home they rented for 4 years, but the case was settled before going to trial. And who was that landlord? Stanley Rochkin, who owned hundreds of rentals in Baltimore, which have drawn lead paint lawsuits. He was fined $90,000 in 2001, and he had 480 rental units in Baltimore that required the removal of lead paint. And in 2002, and I have provided you with the numbers regarding the energy cutoff, Freddie Gray's family came to the attention of Child Protective Services. We reported his family was living in a house without food or electricity. His mother, Gloria Darden, never completed high school, dropped out of middle school, and could not read, and began using heroin at the age of 23. The war on drugs. And we talk about the million-dollar blocks of Freddie Gray's neighborhood. But when Freddie Gray was arrested, he had no drugs on him, only a switchblade. But he was arrested multiple times for marijuana possession and minor crimes like gaming, cards, and dice. I put that in quotes because I thought that was pretty interesting. Gaming, cards, and dice. He served time in Jessup for possession with the intent to deliver. And regarding the war on drugs, blacks and whites smoke marijuana at roughly the same rate, but the per capita arrest rate for blacks in Baltimore was 5.6 times higher than the rate for whites in 2010. And despite that arrest rates declined by 20% during Mayor O'Malley, who was recently running for president under zero tolerance policy, the arrest rates for blacks increased by 20%. And so this was a recent article published in the New York Times. Has anyone read it? In the heroin crisis, white families seek gentler war on drugs. When the nation's long-running war against drugs was defined by the crack epidemic and based in predominantly black urban areas, the public response was defined by zero tolerance and stiff prison sentences. But today's heroin crisis is different. While heroin use has climbed among all demographic groups, it has skyrocketed among whites. Nearly 90% of those who tried heroin for the first time in the last decade were white. That's pretty interesting because the war on drugs was fought primarily in Baltimore, and if you know the history of Baltimore and you've watched The Wire, if you don't know the history of Baltimore, who's a Wire fan? Me. Okay? Baltimore was a city that, unlike most American cities, was ravaged by heroin. It really wasn't a city that was driven by cocaine and crack, more so than heroin. And it still continues to be the epicenter of the heroin trade today and has some of the highest levels of pure heroin in the country. So I find that to be quite interesting. And this is a quote from the drug czar. And if you know anything about drug czars, and I'm going on a tangent now, the term the drug czar was actually created by Vice President Joe Biden, who was one of the architects of the war on drugs and created and had a hand in creating the National Drug Control Policy Office. And so this is the new nation's drug czar. Because the demographic of people are more white, more middle class, these are parents who are empowered. They know how to call a legislator. They know how to get angry with their insurance company. They know how to advocate. They have been so instrumental in changing the conversation. But Kimberly Crenshaw at UCLA Law says, this new turn to a more compassionate view of those addicted to heroin is welcome. But, she added, one cannot help notice that had this compassion existed for African Americans caught up in addiction and the behaviors it produces, the devastating impact of mass incarceration upon entire communities would never have happened. And so what is the history of police brutality in Baltimore? Well, in the last 5 years, 100 instances were cited where police paid settlements of police brutality cases totaling $6 million. And some of the victims included a 15-year-old boy riding a dirt bike, 26-year-old pregnant accountant who witnessed the beating, a 50-year-old woman selling church raffle tickets, a 65-year-old church deacon rolling a cigarette, and finally, an 87-year-old grandmother aiding her wounded grandson. And in virtually all instances, the charges were dropped. And so I also conduct a study at University of Maryland Medical Shock Trauma, and I had a data set of 191 black men who were treated by that trauma center for gunshot wounds. And if you can see the numbers here, 88% of the men that we encountered had been previously incarcerated. Almost 60% have been hospitalized multiple times for violent injury. That's defined as trauma recidivism. And previous history of incarceration was the most significant factor for repeat violent injury. And I suggest that one of my colleagues, Evelyn Patterson, who will be making a presentation on November the 23rd through the Pop Center, has conducted extensive research on the social determinants of incarceration and as a social determinant of health, and found that only among one group that was incarcerated had a higher level of mortality outside in the community than they did while they were incarcerated. And I'm sure you can assume and guess which population that was: black men. Now, that doesn't mean she's advocating, nor do I advocate, that incarceration should be used as a safe haven for black men, but it's clear that the structural conditions that exist in neighborhoods, particularly in Sandtown, Winchester, and Harlem Park, create conditions where black men are more likely to be killed while they're in their community than when they're incarcerated. And so 60% of the people that I work with, if they're enrolled in the ACA, are classified as unidentifiable, which means that the navigator can identify them only through their credit report or tax reports. So if you know much about the ACA, that's the way that they define you or classify your identity if you don't have a Social Security card, an ID, photo ID, or a birth certificate. And so finally, the Ferguson effect. If you watch Melissa Harris Perry, she discussed in very intimate detail about the Ferguson effect on Saturday, I believe. And there's a national conversation of whether police are actually taking a knee. Now, former Police Chief Batts openly stated in a press conference that officers took a knee after the April riots following the death of Freddie Gray, allowing crime to spike because they felt a lack of support from commanders. Is this going to be a tactic where police don't feel supported, so they allow the crime rate to grow up and the reformers lose their jobs? Well, that's pretty interesting, because even if we don't consider that to be a plausible explanation, we have to consider the fact that if police were engaged in that kind of practice, although they might not have been the finger behind the trigger of that gun, they also engaged in structural violence by allowing those murders to happen. So they're complicit. Now we can have a debate on whether crime rates had gone up before Freddie Gray and in other cities across the United States, but that's just something to think about. And so we have the director of the FBI, James Comey, also engaging in the same discussion and narrative. And he says, in today's YouTube world, are officers reluctant to get out of their cars and do the work that controls violent crime? Are officers answering 911 calls but avoiding informal contact that keeps bad guys from standing around, especially with guns? I don't know. That's a question that's still up for debate. But I can tell you, I've sat in numerous meetings with the violence intervention program that I work with in Baltimore, and before this even became an issue, a public issue, there were several staff members who work on the street, on the ground, who were discussing right around the time that Freddie Gray was murdered and we had the protests, that they were hearing from the communities that the police were no longer policing neighborhoods in Baltimore. and they were only responding to 911 calls. And so my closing remarks are human rights literature up to this point has not adequately addressed what it means to have structural violations of human rights. Structural causes are responsible for constrained agency is pivotal in making the transition from structural violence to structural violence of human rights. We must go beyond what is ethnographically visible. When you see starving children, diseased bodies, black male bodies lying in the street riddled with bullets, i.e. Michael Brown, and poverty, there is no easy pointing of fingers. We have to ask ourselves, why does this situation exist? If violence is considered a disease, who is responsible? Who is to blame? And how do we cure it? And much of the work we have done on structural violence is situated in an international context. But I would go on record to say that it's actually no more than 40 miles from here. And if we really want to be honest, it's no more than 8 miles from here. In all the wards that are east of the river in southeast DC and northeast DC. And so what could we have done with the $6.4 million that we gave Freddie Gray in his death that we could have provided to save his life and the life of others? And so I'll just close with a quote from Ta-Nehisi Coates' book, Between the World and Me. I think it's very important because it kind of gets at the heart of these issues. And he's also a native of Baltimore, so I thought it was very salient that I take a quote from his book. And he's writing to his son. He says, I write you in your 15th year. I am writing you because this was the year you saw Eric Gardner choked to death for selling cigarettes, because you know now that Renisa McBride was shot for seeking help, that John Crawford was shot down for browsing in a department store, and you have seen men in uniform drive by and murder Tamir Rice, a 12-year-old child whom they were oath-bound to protect. And you have seen men in the same uniforms pummel Marlene Pinnock, someone's grandmother, on the side of a road. And you know now, if you did not before, that the police departments of your country have been endowed with the authority to destroy your body. It does not matter if the destruction is a result of an unfortunate overreaction. It does not matter if it originates in a misunderstanding. It does not matter if the destruction springs from a foolish policy. Sell cigarettes without the proper authority, and your body can be destroyed. Resent the people trying to entrap your body, and it can be destroyed. Turn into a dark stairwell, and your body can be destroyed. The destroyers will rarely be held accountable. Mostly they will receive pensions, and destruction is merely the superlative form of a dominion whose prerogatives include friskings, detainings, beatings, and humiliations. All of this is common to black people, and all of this is old for black people. No one is held responsible. And I think that last sentence sums up structural violence. Thank you.